Hello everyone, today the topic of our discussion is neonatal resuscitation, also known as emergency condition, in which 10% of the neonate borns are suffering from organ injury and death, and it really put them at the risk of organ injury and death. Neonatal resuscitation is carried out in two procedures, which are through positive airway pressure and in severe cases is the chest compression. These two procedures help them to put in breathing on their own with the attendant normalization of the heart rate. Apgar score is one of the factors that is used to determine if the baby is in healthy condition or not. It describes the cardiorespiratory and neurogenic condition of the baby. The score is not a tool to guide resuscitation or subsequent treatment and does not determine the prognosis of an individual patient, but the Apgar score assigns 0 to 2 points for each of 5 measures of neonatal health, that is appearance, pulse, grimace, activity, and respiration, which is the Apgar score. Appearance, if it is pink, then 2, extremities blue, then 1. If the baby is pale or blue, then 0. Pulse should be more than 100 BPM, and if it is less than 100, then it is 1. And if there is no pulse, then it is 0. If it cries and pulls away things, then grimace is 2. If there is weak crying, then 1. And if there is no activity, active, less and arms fixed, and no activity at all. Respiration is strong, then 2. Slow and irregular respiration, then score is 1. And if there is no respiration at all, then the score is 0. Assessing all these Apgar scores will tell that what is the condition of the baby at the time of. Then there are certain algorithms that you have to follow. And in first 30 seconds at the time of birth, you have to check the term gestation of the baby. If it is full term, preterm, or post-term, amniotic fluid is clear or no, breathing or crying, and good muscle tone or no. If it is yes, that all the condition is normal, then there is a routine care of the baby. And if it is no, that is it is either post-term or preterm, amniotic fluid is not clear, or muscle tone is weak, then in all such conditions TABC is taken into account, where T stands for temperature, A for airway, B for breathing, and C for circulation. Temperature in airway at step 1 is followed, where the baby is given warmth with the hands or airway to clear the airway of the baby, air passage of the baby is the step 1. Then in the next 30 seconds, or you can say first 60 seconds, you have to evaluate respiration, heart rate, and color. If there is apneic condition and heart rate is less than 100, apneic condition, there is no oxygen at all, then provide positive pressure ventilation. And if there is breathing but cyanotic condition, if the baby is breathing but in cyanotic condition, then give supplementary oxygen. Supplementary oxygen देने के बाद भी if it is persisting, then provide positive pressure ventilation. And in सबके बाद post resuscitation care. And if the heart rate is normal, that is greater than 100 BPM, and the baby color tone is pink, then observational care is done in that case. Even after administering all these chest compressions, the heart rate is less than 60, then you have to go for epinephrine, then you have to administer epinephrine. Endotracheal intubation may be considered at several steps. You have to monitor SpO2 at each steps, and if necessary coordinate it with PPV. These are the certain algorithms of neonatal resuscitation. Thank you for watching my channel.